This is Sam Visnic here from EndYourBackPainNow.com, and today what we're going to do is we're going to talk briefly about the sacroiliac joints. Now, the sacroiliac joints can be a significant source of pain, particularly when there is a problem with stabilizing them. So the question is that first of all, what is the sacroiliac joint? Well, in the pelvis, as you can see on my model here, we have these two large bones called the ilium, and in the center here, this would be the back side of the spine, we have the sacrum, and the point at which these bones intersect with this sacrum, the plate in the middle here, it creates a joint, and that is their sacroiliac joints. So we have two of them. We have one on the left and we have one on the right. Now, the majority of this joint is comprised of ligamentous structures, so it's very dense and tough, and there's a tremendous amount of stability in the joint normally. There are a few situations in which there can be a natural instability in the joint for small periods of time, in particular when women are pregnant. A hormone called relaxin is released, and it relaxes the ligaments in the sacroiliac joint, and it does so for an obvious purpose, to be able to loosen up the pelvis for the birthing process. Now, for most people though, the sacroiliac joints fit together quite tightly and nicely, and there isn't much room in there for motion. Most experts will agree that the sacroiliac joints produce very small amount of motion, somewhere in the neighborhood of 1 to 3 degrees of movement, which is very little and quite frankly not measurable. So when we're looking at sacroiliac joint dysfunction, what we're looking for mostly is the positioning of the ilium relative to the sacrum. So it can create any degree of motion or malpositioning here, if you like. The ilium on the left side, for example, could be more anteriorly rotated relative to the right, or the sacrum could be in a twisted position. There's many different positions that the sacrum can assume relative to the ilium, which will cause strain on the sacroiliac joints. So one of the things that's important to remember about the sacroiliac joint, to keep in mind anyway, is that the sacroiliac joints are not moved by any particular muscles. So there are no muscles in this area, in the lumbopelvic hip complex, that actually cause motion in the sacroiliac joints. But the muscles in the core and around the lumbar spine can influence the stressors that go through the sacroiliac joint as your body transfers force from the upper to the lower body. So what I'm saying is that muscular imbalances can influence sacroiliac joint dysfunctions. However, when the sacroiliac joint subluxes or goes out, there are not any direct muscles that you can strengthen or weaken that will move the sacroiliac joint in place per se. Now, what I'm not saying is that muscles aren't important in sacroiliac joint conditions. Rather, what I'm saying is that it's going to be dependent on two major scenarios. First of all, when the sacroiliac joints are in place, but they create pain because of the imbalances that are happening in the lumbopelvic hip complex, then we will address this with muscular stabilization exercises. So in this situation, the muscles on the front side and the abdomen, in particular the deep abdominal stabilizers, such as the transverse abdominis, the pelvic floor, the diaphragm, and the small multifidus muscles, all create an important deep stabilization mechanism for all of these structures. Now, the outside muscles, the global large muscles such as the glute maximus, the lumbar erectors, and the outer abdominal wall, and the outside glutes, TFL, and so forth, these are all important for stabilizing the sacroiliac joint region during motion. So we need to be aware that all of these muscles need to be in proper balance from front side to back side, and be activating at the right time during movements in order to stabilize this joint. However, there are many cases where I've seen patients who walk in my door with their sacroiliac joint having gone out, and it usually creates quite a significant amount of pain, and it's usually quite obvious when it's happening. And muscular efforts can be very challenging because the muscles are generally locked up around the area trying to protect it. So in that situation, there's not a whole lot you can do. Richard Dontigny, a well-known physical therapist, recommends some mobilizations that work probably, I'd have to say, in about 30 to 40% of the time when the SI joint is really out. Although personally I've had difficulty with this in some patients who, when their SI joints go out, they require manual mobilization. And the reason why is because usually the pelvis needs to be anchored in a certain direction so that movement can occur and get the SI joint back in place again. So most of the time requires very light manual mobilization of the area, and more extreme cases may actually require a chiropractic adjustment. So in that situation, the adjustment or the manual mobilizations are the clear treatment option for sacroiliac joint dysfunction. And once the sacroiliac joints are balanced and put in place again, then we want to make sure that we're doing the appropriate exercises for balancing the front and the back side, and of course side to side. So we want to create optimal muscle balance within the deep stabilizer system and the global muscles in order to effectively treat sacroiliac joint pain. This is Sam Visnic again from EndYourBackPainNow.com, and I'll see you next time.